Hey everyone, endometriosis is a very complex condition to treat. And when we're looking at the root causes of endometriosis, there's a few key different areas we really want to focus on. Um, Endometriosis, along with PCOS, is one of those unique conditions where there's a lot of important factors to address and often have a combined contributing um, a combined contribution to the pathogenesis of a condition like endometriosis. So, first of all, when we're looking at endometriosis, we want to look at something called, estrogen dominance. So we usually have higher levels of estrogen compared to progesterone in the body, and there's a few reasons why this can happen, and we're going to talk about that. The second important factor to look at with endometriosis is the increased levels of inflammation. So we usually see there's a higher secretion of specific cytokines, inflammatory cytokines, and mediators that increase baseline inflammation, increase inflammation of the uterus, and can affect pain levels and cause discomfort in other surrounding organs as well. The third important area to look at is the immune system. We see there's a bit of immune dysregulation. So we have these cells called natural killer cells and T cells, and they have a very specific role in targeting foreign tissue and helping to break it down or to digest it and remove it from a specific location. So with endometriosis, when we start to have these endometrial cells start to implant in locations where they shouldn't be, the immune system for some reason is unable to um, basically lock on to them and to remove them and to target them. So we have this dysregulation. And what we want to focus on for today's topic is the role of the microbiome in the digestive tract and in the uterus that actually contribute to endometriosis and all these three main factors we've mentioned. So, first off, it's very interesting to mention, there was a study that found if patients with endometriosis were given antimicrobials for a period of time, they actually saw a significant reduction in the severity of the endometriosis lesions, which signals that there's some sort of benefit from this antimicrobial happening not just on the microbiome but for the endometriosis, and why the two may be linked. So there was a wonderful systematic review and meta-analysis published recently, and they basically looked at what does the microbiome look like for patients in endometriosis. And this to me was mind-blowing because the researchers were actually able to diagnose which patients had endometriosis just from a stool sample. So they could look at the stool, they would identify the main types of bacteria and microbes present, and there was a basic um, you know, picture of what a microbiome looked like in endometriosis patients, and they were able to use that fairly accurately to diagnose endometriosis. And what that endometriosis microbiome looked like in the gut was we see there was an increase in certain populations, particularly Escherichia coli. So we see higher levels of this gram-negative bacteria. And gram-negative bacteria contain something called LPS, or lipopolysaccharides, and they can trigger the immune system and cause inflammation as well. So when we have higher growth or an increased population of this gram-negative bacteria, we potentially have this upregulated signal from the lipopolysaccharides triggering the immune system and triggering inflammation. And so that contributes to two of the factors we were discussing for endometriosis as part of the root causes for endometriosis. So we're seeing increased levels of inflammation, and we're also seeing this contribution to immune dysregulation. The important, third impact we're looking at for the estrogen levels being disproportionately elevated compared to progesterone. And estrogen, this extra estrogen, acts like jet fuel for the endometriosis cells. So it encourages them to grow, and it's a very stimulating signal for them. Escherichia is part of a group of bacteria that collectively make up something called the estrobolome. The estrobolome basically help to reabsorb estrogen from the large colon back into the circulatory system. So the liver works very hard to metabolize and excrete excess amounts of estrogen, and we get rid of it through the bowel movement. And this estrobolome has a role in breaking this estrogen compound back away from the compound is attached to and reabsorbing into the system to reuse. So it gets, transported again to different organs, the skeletal system, the reproductive system, the nervous system, etc. And so this estrobolome is there naturally, but we see in endometriosis with this increased growth of the Escherichia population, we might actually be reabsorbing much more than we typically would if the microbiome was healthy and balanced. And so this contributes to the imbalance of estrogen in the body, which can also worsen endometriosis. Interestingly, when we looked at the reproductive microbiome, so far we've just talked about the gut microbiome and the large colon, the reproductive microbiome, so the main bacteria found in the uterus, in the fallopian tubes, on the ovaries, which previously we thought was actually sterile, right? And over the last couple of years, we've seen actually there are certain populations of bacteria present. So instead of having what's called a lactobacillus dominant population in the reproductive microbiome, which has been strongly associated with increased implantation rates, decreased miscarriage rates, we start to see the growth of other harmful microbes. And in endometriosis, there's a particular one that we see goes up in population called the Gardnerella vaginalis. And Gardnerella has been strongly associated with increased levels of inflammation in the reproductive tract. So we potentially have this increased growth of this microbe that can further exacerbate inflammation in the endometrium and in the uterus that's already present from the endometriosis. Now, these are like correlations, not causations, but it's important to notice that, independent of endometriosis, this microbe has already been associated with increased levels of inflammation. So when we're treating endometriosis, in addition to looking at conventional methods of treating endometriosis and patients who are trying to conceive with endometriosis, it's very, very crucial we have a deep dive and look under a magnifying glass almost like to zoom in on what the microbiome is doing and how to help patients struggling with infertility and endometriosis on how they can improve their chances of success, reduce symptom severity. And so we often see in patients with endometriosis as well that once the microbiome is balanced, we start to see potentially decreased levels of pain, less inflammation, less severe menstrual cramps, and along with other hormonal changes and other symptoms associated with them. But mainly, the microbiome, not just from reducing the endometriosis lesions, because endometrial lesions can further contribute to infertility by activating and secreting other immune cells, which actually are cytotoxic or toxic for the sperm cell. So they kind of rip the sperm cell head apart, the byproducts from these endometrial lesions. But in addition to that, if we're having this growth of unhealthy bacteria in the reproductive microbiome, even without endometriosis, we've seen that without having a dominant lactobacillus population in the uterus, we see miscarriage rates tend to go up a lot and implantation rates can go down. Two of the latest studies published in this summer found that just having an unhealthy microbiome in the reproductive tract might have increased the miscarriage rate by almost up to 5 to 10 times compared to patients that had a healthy microbiome in the uterus. So it's also looking at, what can we do to help improve endometriosis, but also helping to improve general fertility and implantation, reducing miscarriage rates. And, endometriosis, I think the biggest question leading up to this video I was making for this week, some patients and some of you were already contacting me like, hey, are probiotics great for endometriosis? Should I be taking probiotics? Each condition is different. And with endometriosis, we have an increased growth of some of these bacteria that a lot of the probiotics give anyways. So we're seeing higher levels of actinobacteria, the bifidobacterium, a lot of lactobacillus species, they're already increased in the gut microbiome in endometriosis. So we need to be careful with what kind of probiotic we're giving to each individual patient. And actually, a lot of the digestive symptoms will also help to determine what that microbiome may be looking like. So if this is something you're working towards or dealing with, it's important to sit with your healthcare provider and have a closer look at this. If you have any questions, send us a direct message, or as always, drop us a reply here, and we'll be happy to respond.